he's stable and he comes. I also welcome Professor Chandan Gowda, the moderator of today's lecture. I welcome all the governing body, board of governance members of ISAC, the life members, our faculty, distinguished faculty, staff, and students, and all the distinguished guests online. The lecture is online because now, because of the pandemic, the physical activities are constrained. And within a fortnight, we have this second lecture. We had Dr. Sanjay, who presented on COVID a fortnight back, and we are coming back with the lecture on governance, policy decision, and lessons on how to manage a pandemic, delivered by Professor Ashish Jha. Professor Ashish Jha is very well known. He if our colleagues go on YouTube, you can see a series of lectures, series of advice on how to manage pandemic. I was delighted to see one of his lecture, which was online streaming sometime during the first wave of COVID, where he is being interviewed by his mother in Hindi, and it was live shown in a TV Bihar Tak. It was really delight to see how he is very simply explaining to the masses how to prepare about COVID. So I will not take much time, but before we start the lecture, it is my duty to just formally introduce Professor Ashish Jha, Dean, School of Public Health, Brown University. Dr. Jha is recognized globally as an expert on pandemic preparedness and response, as well as on health policy research and practice. He has led groundbreaking research around Ebola, which happened in Africa, and is now on the front lines of the COVID response, leading national and international analysis of key issues and advising state and federal policy makers. Dr. Jha has published more than 200 original research publications in prestigious journals, such as the New England Journal of Medicine and BMJ, and is a frequent contributor to a range of public media. He has extensive research how to improve the quality and reduce the cost of healthcare, focusing on the impact of public health policy nationally and around the globe. Dr. Jha is currently the Dean of the School of Public Health at Brown University. Before that, he was faculty member at very prestigious Harvard T.H. Chan School of Public Health and Harvard Medical School since 2005. He was the director of Harvard Global Health Institute and also served as the Dean for Global Strategy at the Harvard T.H. Chan School of Public Health. He is very well known. We can see our former minister, M.K. Ramesh. He is there among us for attending today's lecture. Jairam Ramesh, he is there with us. I welcome you, sir. I welcome the distinguished audience, distinguished guests, and I hope our today's chair, Professor Abhijit, will join in the meanwhile. So I request Dr. Chandan to moderate. I think we straight away will go ahead with the lecture, and then Chandan, you keep the time, and we will have time for some questions from the floor. I welcome you all. Over to Dr. Ashish. Thank you for joining us.
So good evening, everybody, and thank you for welcoming me here. I'm very pleased to spend some time with you. And what I will do is over the next 25-30 minutes, I will lay out, I will lay out the state of the pandemic globally, as well as a little bit about the United States and a little bit about India as I have watched it and studied it from a distance. and lay out what I think what the successes have been globally, what the challenges have been, where things have gone right and wrong, and how we might move forward. And after covering all of that in as I said, 20, 25 minutes, we will have still a nice amount of time for questions. I always find that in these kinds of discussions, it's the questions that are the most useful and valuable. So I will keep my remarks a bit on the shorter side so we have more time for questions. But it really is an honor to be here, and thank you. And yes, I have now done several videos with my mother, all of which are available. I will tell you the reason behind it. One is my Hindi is not that great. I left India, I left Bihar when I was 9. And so my Hindi is that of a 9-year-old in terms of my vocabulary. And but I still speak Hindi with my mother, and so it's very comfortable. Also, she asks really good questions that average person wants to know. She's not in medicine, she's not in healthcare. She asks those questions that everybody wants to know, and explaining it to her lets me explain it to people more broadly as well. And it has been a very and of course, the last but not least is, you know, when you think about communicating and speaking to people in UP and Bihar and other places in northern India, speaking in English represents a barrier. It represents a barrier for many people. And so being able to speak in Hindi is helpful as a way to communicate. Okay, let's take a step back and say, where are we right now with the COVID-19 pandemic? So across the world, and again, I'm going to keep my, you know, obviously I'm going to speak most in English, and I can do a little bit of Hindi, but I think in this audience, English will be really ideal. Across the world, officially, just based on official numbers, there are about 175 million people who have been infected with this disease. And so if you just look at the official numbers, you would say, you know, that represents about 4 or 5% of the world's population. Of course, we don't think that's the real number. We think that the real number of infections is much, much above that, maybe closer to 2 billion, or maybe almost 20% of the world's population has probably been infected with this virus. It could be higher than that. I don't think it's much lower than that, 25% of the world. Why do I say it's so much higher than the official numbers? Because in most countries and during peak times, there is massive undercounting of infections because of a lack of enough testing. And lack of enough testing means lots of people get infected, they recover, maybe they even die, but never get identified as having COVID. And so my best estimate is that across the world, 20 to 25% of the world has already been infected. That means that we still have a long way to go to ending this pandemic, because the pandemic will come to an end when somewhere around 70 or 80% of the world has immunity. Now, of course, that is not going to be evenly distributed. Some people will get there much before others, but we need to have most of the world have immunity. And it is much, much better to have it through vaccines than to have it through infections. And we will come back to that idea as well. This pandemic began about, we think, in December of 2019, maybe January, but really my best estimate is that the infections started spreading in Wuhan, China, probably in November, was spread through much of China in December. And by January, and probably by late December, but early January, it had spread to many parts of the world. And so we are now approaching 18 months of this pandemic. And it would be, I think, reasonable to guess, and this is what will happen next is up to us, but my best guess is we probably have another 18 months or so to go before things are much, much better around the world, which is another way of saying we're about halfway through this pandemic. Now, when the pandemic comes to an end, as I said, will vary from country to country. And it will come to an end much more quickly in many high-income countries. And in many low and middle income countries, it will take much longer, largely because of the vaccine challenges. And I will come back to talking more about vaccines in a few minutes. Okay, so one thing to think about is This will end up being about a 3-year-long pandemic. We're about halfway through that right now. So a lot of time ahead of us and a lot of work to do to get that. Now, let's talk a little bit about the state of the pandemic in different parts of the world today. If I was speaking to you 4 or 5 weeks ago, I would have said, and of course you would have known this, that India was at its peak 4 weeks ago. The world was at its peak. The world was generating almost official numbers, almost 1 million infections a day or 10 lakhs a day. That number has come down globally, and the Indian infection numbers have certainly come down quite a bit, from 4 lakhs at its peak down to under 1 lakh a day now. That is very, very good progress. And again, we can talk about what has both what caused the problems in India, but also what has led to the decline when I come back to speaking about India. But globally, we are in we've been seeing these global waves. We just had a very large second wave globally, and we are now coming down off that wave. There is no question in my mind there will be future waves, because there won't be. There will almost surely be. So the challenge globally right now is to figure out what can we do to get through this wave and prevent the next ones. And I'm going to discuss that a bit more specifically around India in a few minutes. But that's the global picture. Here in the United States, things are in generally very good shape because of vaccines. One of the very few things that the Trump administration did right, the Trump administration did quite a bad job of managing this pandemic. But one of the few things they did very right was back last June or July, a year ago, they made a very big investment in vaccines. They made large investments in funding the vaccine development and made large investments in purchasing the vaccines, even before there was any data that these vaccines would work. And those investments, those bets paid off. When the vaccines were ready, they came to America first. And we can talk about whether that's a good policy or not, and I have very mixed feelings about that. But it did mean that America has a lot of vaccines on hand. Right now, about 64, 65%, so almost 2 out of every 3 adults has gotten vaccinated. And because of that high vaccination rate, infections across America are way, way down. They're down almost 95%. That's out from our peak. Our peak was in January. We had 2.5 lakh cases a day. Yesterday, we were down to about 12,000 cases a day. So that was yesterday. So we are way down from our peak, largely because of vaccinations. The country's largely open. Things are going well. There are a few challenges with the US, and then I will shift to talking about India. And then I do want to talk a little bit about this. The title of this is also about governance and social cohesion, which I think is at the heart of understanding this pandemic. So the challenges for America are, we have a high number of people who don't want to be vaccinated, probably 20 to 30% of the population. Without vaccinating them, it will be very, very hard to get this virus under complete control. Second, the Delta variant, the variant that was initially seen in India, the B.1.617.2, sometimes called the double mutant. It has become widespread in the UK. It is starting to spread in the United States. And if we don't get our vaccination numbers up, we will see another spike in cases, especially as we get into the fall season, September, October. So the US is in very good shape, but it's not completely out of the woods. It still has challenges ahead, and it will need to manage those challenges. But I want to shift at this point to talking about India, as I have watched India from a distance. And there are many, many people in the audience who obviously understand the coronavirus spread and response in India much better than I do. I am obviously somebody who, I'm an Indian. I grew up there, but and I come and visit often to see my family and work. But obviously, in the last 2 years, I have not been able to come. So everything I can see, I see from a distance. And so I say that because I may say things that you may disagree with, and I hope you do, because then we can have a very nice discussion in the conversation that follows. So my assessment, as I have watched the Indian situation, is that when the outbreak initially began in March, late February into March, I was actually quite supportive of the lockdowns. And the reason, now we can talk about some specifics about how lockdowns were done and how quickly and what to do with migrant workers. There were a lot of complexities. It was nothing is perfect in the beginning of a pandemic. But without a lot of information, I think the government took decisive action. And I think that actually helped save a lot of lives in the early days. And I have commended the government for that. I think they did a good job. And that really made a very big difference in keeping India's infection numbers lower, deaths lower. One of the surprises for me in watching India is as then the lockdowns lifted, case numbers went up. And as cases came down over the fall and winter, I have to say, and I've said this publicly, I was puzzled by how much infection numbers dropped as we got into December and January. And in January, I was asked to give a speech at a university, and the organizers of the speech asked me, they gave me the title, which was, "How did India beat the pandemic? How did India beat the COVID pandemic?" This was in early January. And so I said to them, I will come and give that speech, but I don't know how India beat the pandemic, and I don't have any theories. And I will tell you that I remain very concerned that India has not beaten the pandemic, because it makes no sense that India could have. And I gave a talk. It was not a very satisfying talk for the audience or for me, in which I laid out the 5 or 6 main theories that people had put forward for why India was doing so well in January. And each of the theories I walked through and explained why it couldn't quite be right. And at the end, I was left with a very unsatisfying conclusion that the Indian numbers are better than I expected, but I don't think they're sustainable, and I don't know what will happen in the future, and I remain worried. And that's because, Indians are not, we are no different in terms of humans than other people. There is no evidence that one group of humans is more resistant to this virus than another. And everything I knew about the immunology of the disease, the infectiousness of the disease, made me think that India was still quite vulnerable. You can see in the infection numbers that India begins to rise again. The case numbers in India begin to rise in late February. And I would argue that by February 25th, 28th, it really was obvious that things were starting to get bad. The problem with this pandemic is that people have a hard time understanding relative case numbers versus absolute case numbers. Let me explain what I mean. When in early to mid-February, infection numbers in India were down to 10, 11,000 a day, very low numbers. 2 weeks later, it was up to 20,000. Now, 20,000 doesn't sound so much in a country like India, but it had doubled. And that should have set off alarm bells. In about 3 weeks, it had doubled. So that should have set off alarm bells. By early to mid-March, it had gone up another twofold. Now you could say, hey, 40,000 is not so bad. But this is the problem of this pandemic, is that it lulls you, it relaxes you. And then by the time you get to 100, 200,000, and it's doubling, things are very bad and very hard to stop. So you always have to act quickly and early. And and I've been very open and very public about this. I believe there was a large missed opportunity between late February, and look, maybe you can say late February, a lot of people could have missed it. By early March, mid-March, there was no explanation for missing it. And by mid-March, it was certainly clear to all of us. In late March, I was doing television and other things in India saying, this is really bad and it's going to get much, much worse. And I could see that from here. Certainly the great scientists and the very substantial capability within India could see it as well. And I was hearing from Indian colleagues that same level of concern. And it really took too long to respond. And we can come back to talking about why And I don't think these need to be political issues. These need to really be about governance and how we manage these kinds of things in a pandemic. Of course, India then in April into May has suffered enormously. At the peak, the official numbers were 4 lakh cases and 4,000 deaths a day. But I think there have been many efforts to estimate how many actual number of infections and deaths were there. And my best estimate, based on looking at data from lots of countries over the entire pandemic, almost every day I look at data from many, many dozens of countries and try to make sense of what is happening. My best estimates are that India probably had not 4 lakh cases, but probably something in the order of 20 to 30 lakh cases a day at its peak. And number of deaths was probably closer to 20,000, not 4,000, and that we were undercounting by 80%. And I can walk through the logic behind that if you want, but there is no question in my mind that 4,000 was not the right number of deaths. It was, could it have been 15,000? Maybe. Could it have been 30,000? Maybe. Somewhere in that range was probably the real number of deaths that were happening. Good news is obviously things are getting much, much better. And that I think is a reason to celebrate, and not celebrate, but really to feel relieved. The big challenge for India moving forward is, what do we do as the country comes out of lockdown? How do we prevent another wave? And at this point, I want to talk about kind of what do we know about preventing large scale spread. And this is something I would argue we have known certainly since last April or May. And they're really quite straightforward. Here are the principles of this virus that are very clear. Principle one is that the virus is airborne. It spreads indoors largely, and it spreads indoors largely in poorly ventilated places where people are not wearing masks. You can get outdoor spread, and there's plenty of data of outdoor spread. But outdoor spread happens with large crowds. So when people are packed together for long periods of time outdoors, you can definitely see spread. But most of the spread tends to happen indoors, and it tends to happen when people are not wearing masks. That is the fundamental principle of this virus. The other fundamental principle of this virus that has made the virus very, very difficult to manage, makes it one of the main reasons why it has become a global pandemic and such a challenge, is that almost half of the spread happens when somebody is asymptomatic, when the person doesn't have symptoms. So the classic clinical situation is, let's say this morning I get infected. I won't develop symptoms for 4 or 5 days. But after about 2 to 3 days, I will start spreading the virus. So there's a 1 to 2 day window when people have no symptoms. They feel completely fine, but are spreading. And that is very different than the original SARS virus of 2003, where spread happened mostly by symptomatic people. That asymptomatic spread has been a major reason why we have seen large outbreaks, because if you don't have symptoms and you feel well, it's hard to know, right? You don't know you're infected. So all of these scientific principles then lead us towards the public health response that is important. So what is that public health response that is important? So number one is got to be high quality mask wearing. When people are outside of their homes, when they're outside, certainly, outside is important, but certainly when they're indoors. If you go into a shop, if you go into a restaurant, if you go into an office place, everybody needs to be masking up. If you're not masking up, you are creating a very high level of risk. Second is we have to try to improve indoor air spaces, open up windows, and this is very important. And this can be a difficult thing in India, especially during hot summer months where we want to often close things and run the AC. That can be quite a dangerous situation. And so if you're going to have people inside, then you want to open up the windows, open up and get fresh air going as much as possible. So mask wearing, ventilation, avoiding large indoor gatherings of any kind, and even avoiding large outdoor gatherings. So outdoors, you have a little bit more leeway. That's one set of public health measures that's very important. Second set of public health measures is testing. And testing, we tend to think of as something you do after somebody has symptoms. You wake up, you have a fever, you have problems breathing, you go get a COVID test, a coronavirus test. That's fine. That's important from a medical point of view. But public health testing is large-scale testing to try to identify people in that pre-symptomatic period, to catch them before they've had a chance to spread it to many people. That requires a very, very high level of testing. And I think India has the capacity to do it. Almost no country has pulled that off. Few countries have. South Korea has done that, others. But it will require a scale up of testing at a very different level than India has right now. And that, I believe, will be a very critical part of preventing the third wave. So if you think about prevention of spread of this disease, it's mask, indoor and outdoor, and ventilation and avoiding crowds. It is testing. And then, of course, the last but not least is vaccines. Vaccines are how we end this pandemic, and we've got to get vaccinations out to India, across the country. And my best estimate, looking at data from Israel, from the UK, from the US, is that we probably need to vaccinate 50 to 60%, maybe closer to 60% of the population before the pandemic really comes to a halt. That's a lot of people, right? That's a lot of people. 60% of India is a lot of people, and we've got a lot of work to do on that front. Let me finish off by saying two things, and then I will take questions. First is, if we were speaking together 2 years ago, so, well, let me say 5 years ago, I became very, very concerned after my work on Ebola that we were heading towards a global pandemic, that there was going to be one, and we needed to get going and working. And so many people were working on preventing pandemics and what we can do. And there was something called the Global Health Security Index, which was created to assess which countries are best prepared for a pandemic. And the number one country for best prepared, based on this work, this was done at Johns Hopkins, the number one country in the world for preparation was the United States. And number two was the United Kingdom. I would argue that index got it completely wrong. US and the UK have not done very well. So the question is, why did they get it wrong? What has it taught us about the pandemic? And I want to finish with this. What that index, that model did, and by the way, if you had spoken to me 2 years ago, if you had invited me to speak about future pandemics, I myself would have said the countries that are best prepared are the US and the UK. And I would have been terribly wrong. So what did I get wrong? What did all the experts get wrong about the pandemic? What we focused on was things like laboratory capacity, surveillance capacity. What we focused on was how good is the healthcare system, doctors, nurses, hospital beds, oxygen, all very important things. But what we did not focus on was political governance. What happens in a crisis? How effective is the government at being able to marshal forces? None of us paid any attention to that, or very few of us in public health. I am not saying I'm proud of my mistake. I'm saying this is a blind spot for public health that we will have to do much better when we emerge from this pandemic. None of us paid much attention to issues of social cohesion and messaging and information, and how information and social cohesion change people's behavior. You can say, from a policy point of view, everybody should be wearing a mask. But if there is a large misinformation campaign that undermines that public health message, and people then choose not to wear a mask, your message won't work. We didn't think about things like that, or not enough, I would say. And so when I look at countries that have done well in this pandemic and countries that have done poorly, it's not about laboratory capacity or about doctors and nurses and even oxygen supply. It's about how effective is the government at marshaling its forces. It's how effective is the government at communicating to the people, and how much social cohesion can they rally to fight this virus. Countries that have done a good job on those fronts wealthy countries and poor countries have way outperformed countries like the United States and the United Kingdom that have struggled with those issues. So to finish, we are not done with this pandemic. We have a lot of work to do, a long way to go. Yes, we should focus on the biomedical and public health issues like testing and mask wearing. But at least now we have to start working on things like political governance. How do you make government response more effective? How do you have more effective communication to the public? These are really, really critical things, and they're going to be very important for getting us through the rest of this pandemic. So let me stop there. I've spoken for about 26 minutes, which was what I was hoping. I have probably raised many questions, and so I hope I have. And let me take the next 30 minutes to both answer questions, clarify anything I have said. And again, thank you so much for having me here.
Thank you, Dr. Jha, for laying out the field so concisely and in a way that helps think of it with a kind of clarity of a comparative kind that's useful. I have two quick questions, and then we'll take questions from the audience. One is the matter that you raised about how you were able to deduce the actual figure was much higher than the official figure. You said at the peak, you said 4 lakhs was not the correct figure to something else. And you said there's a logic behind why you felt that way. If you could just give the sense for that.
Sure.
And the second question I have is about the high income countries and the low income countries, the relationship between the two. How would you like to see that unfold in ending this pandemic, which is truly, clearly of a global nature? Yes.
Great. Two very good questions. So let me take a few minutes to answer each of them because they're both important and complicated. So whenever I make public announcements about estimates and what the real number is, of course, I want to try to look at any single data from multiple points of view and ask, could these numbers possibly be right? So let's just take a number at the peak, 400,000 cases, 4 lakh cases, and 4,000 deaths. And I begin, and by the way, the other important number there that was very important in my estimation was test positivity of 22%, 21, 22%. That's at the peak, the percent of tests that were coming back positive, right? Because we were doing about 20 lakh tests a day, about 4 lakh of those were coming back positive. So test positivity is actually the best estimate of undercounting of infections. But let's actually come at this in many different ways. One big place to begin is to say, okay, in a non-pandemic time, in 2019, how many people died in India on a normal day, regular average day? About 25, 27,000 deaths a day. That's what India has, normal times. What we were seeing was across India, certainly across much of northern India, but even parts of southern India, this incredible crush of like crematoriums running 24 hours a day, 7 days a week. Bodies floating on the Ganges in a way that we have not seen before. In Banaras, in Varanasi, people running out of wood, and then the government having to step in, and cremation costs that used to be 500 rupees now costing 10,000. First order of logic is, could a 15% increase in deaths cause this? If the normal capacity of India to manage deaths is 25 to 30,000 deaths a day, that's what it does every year, every day, for years. Fluctuations. It could handle a 15% bump with little to no problem. You could not possibly see this kind of a problem. So that was the first signal that 4,000 deaths can't possibly be right. Right. So, and whenever you do this, as I said, there's a bunch of like secondary information, and then I'll get to the data in a second. I was talking to family in Bihar who was telling me about what was happening on the front lines and people they knew who were dying. And they would describe what was causing their death. And I would say, did they get a COVID test? And they said, no, that person was never tested. So you could tell from stories that there was a lot of undercounting. But stories, and this is not what I'm going to base it on. But I knew there was a problem. Now, when you have a 20% positivity rate, it means every 5 tests you do, you get 1 positive back. That's a problem. In a normal situation, when you're capturing almost everybody who's infected, your test positivity should be 2-3%. Because you're casting a wide net and capturing a lot of people. Because remember, a lot of people have mild symptoms, no symptoms. So if every 5 tests is coming back with 1 result, you are missing many, many people. We have seen this across the country, across the world over and over again. In the US at that time, we were at a test positivity of 4%. And my best guess was that we were missing half the cases. And when you get to a test positivity of 20%, you're probably missing 80 to 90% of cases. And there's a lot of math that has been done in modeling to try to look at that. And so based on that estimate, you would assume that instead of 4 lakhs, you're probably at 20 to 25 lakhs. And then you can do things like looking at infection fatality rate. What proportion of people get infected die? Under normal circumstances across the world, we think that's about 0.6% or 6 out of 1,000. Now, let's say India has a bit of a younger population, so that number may be a little lower. But we were also seeing a crush of what was happening in hospitals with running out of oxygen. And you could realize a lot of people were dying unnecessarily. And even if you estimate a 0.5% infection fatality rate on 20 lakh cases, that's 10,000 deaths. So you can start triangulating, and there are lots of different sources of data, but what was very clear was that those numbers were way underestimates. They couldn't possibly be right. But when you look at all the modeling data, and I was looking at data from coming out of Michigan, coming out of the UK, of what's happening in India, I landed at probably about 20 to 25 lakh cases a day, and about 20,000 deaths a day. But as I said, with confidence intervals. But point is, there's a bunch of different sources of data you want to look at together to try to make this estimate. Okay, I'm sorry, I forgot your second question. Can you just quickly remind me? Oh, rich countries, poor countries.
Yes.
Yeah, sorry. Thank you. So this is a global pandemic, and it is not going to end until the world is vaccinated. The wealthy countries have made bets on vaccines early and have bought up most of the vaccines. And what is happening now is as they finish vaccinations, they are starting to get into the mode of donating vaccines. The G7 just announced sharing 1 billion doses of vaccines. Not enough. And what we need is to bolster vaccine sharing, vaccine manufacturing capacity in low and middle income countries. Certainly China has a lot of capacity. India has always been the vaccine manufacturer of the world. And there are a lot of challenges, some of which we can get into if you want, on why India's manufacturing has not been able to do more. But I think that remains a huge opportunity. And the last point, this may not be your question, but let me make this point, is when we come out of this pandemic, we will realize that the global world order we had in global health, which was the wealthy countries have good public health and they teach the low and middle income countries how to do it, that's all gone. The wealthy countries have not done a particularly good job on this pandemic. And there are plenty of low and middle income countries that have done quite a terrific job. And so the relationship between wealthy countries and less wealthy countries is going to have to be renegotiated in a very substantial way. And when you look at a continent like Africa, for instance, that has almost no vaccine manufacturing capacity, they will get through this pandemic, but they will never, ever go into another pandemic without very strong manufacturing capacity. So you're going to start seeing investments in places to become much more autonomous, because I think a lot of low and middle income countries are realizing you can't count on high income countries to bail you out. You really need to have far more internal capacity.
Thank you, Dr. Jha. I'll just read out some of the questions that have been keyed in the chat box. Rahul had his hand up. Rahul teaches law at the National Law School. His question is, does it worry you that India doesn't have a Dr. Fauci leading the pandemic, you know, efforts? Institutionally, is it a problem that politicians rather than experts lead it?
Yeah, this is a very important question. One of the ways in which I think that the Trump administration really mismanaged things is that Donald Trump became the spokesperson for the pandemic. And the reason why, look, it's not an anti-Trump statement to say that. You could love Donald Trump and you still should find that a problem. And the reason is politicians, by the nature of politics, are polarizing, right? Politicians, by their nature, some people love them, some people hate them. And that is true if you're a Donald Trump or a Joe Biden. And when politicians become the major spokespeople, if you don't like that politician, you tend not to want to listen to that message. That's a problem. And so in the Ebola outbreak and when that happened in 2014, 2015, under President Obama, or under President Bush, when there were outbreaks, they always let their scientists do most of the speaking. I think that's extremely important. I think it's extremely important for the United States. I think extremely important for India. You need credible voices who can speak to the Indian people in a way that wherever you are politically, you feel like that person cares about you, cares about your community, and is trying to get the science right. It's a difficult situation, but I think it's important for every country to have people like Dr. Fauci.
There was a question on public transportation. How, is there a way of managing that during this time? And there's another question on whether the public health efforts need to be customized differently to rural and urban areas. These are large questions, but they're here. And there's another question on how to improve information dissemination during the pandemic. Okay.
Boy, yeah, lots of good questions. So let me take a few of them. Let me try to answer all three of them. Public transportation is a bit of a challenge, but I think most of the data I have seen suggests that if you, let me just say it, and some of this will feel more realistic and possible than others. First of all, I think what is absolutely realistic and must be done is everybody has to be wearing masks on public transportation. You cannot allow people to get on a train, plane, bus, any of these things without wearing a mask. That just has to be, because if you don't, then public transportation becomes very substantial risk. That part feels very realistic and doable. I mean, it's hard, but you got to do it. The less realistic part in India is you want to avoid crowding and overcrowding. That can be, at least, last time I took maybe 6-7 years ago, I took a public bus in Delhi. Avoiding a crowding on a public bus in Delhi was not realistic. Now, maybe in a pandemic where few people are traveling, that may be easier. So anything you can do to reduce crowds will be helpful. But most important is everybody's got to be wearing a mask. On the issue of public health in cities versus rural areas, no doubt about it. Rural areas are different, right? So I think about Bihar, where I'm from, and I think about both the district town of Madhubani, where my family is, but also our village. In our village, the upside is all the houses are very open. Everything is very, very, there's very good ventilation. And so that helps in terms of preventing large outbreaks. Of course, the downside of the village is there's essentially no health facility. So if anybody gets infected or sick, it's a huge problem. And the way that the people get infected and sick is they may be working in Patna, they may be working in Delhi, and they come back home. They got infected. Remember, I told you, if I got infected today, it'll be 5 days before I have symptoms. And so I could easily, if I'm a worker in Delhi and I work today, I get infected, I get on a train, I get to Patna, I take a bus to Madhubani. That's 2 days later, I'm still feeling fine and I could start spreading the virus. So you do need to build up some much more capacity for testing. That capacity for testing is much more readily available in Delhi and Bombay and other major cities. And so you need a different set of focus. In those cities, it's much more about crowding. It's much more about identifying people who are high risk and preventing spread for them. Um, and of course, it's also about making sure you have hospital capacity. So those are different set of challenges, different set of responses. On the issue of information, this is the big challenge of our time. And I will be, again, I've been very frank about this. Like, I have to say that when I'm on social media, I tweet a lot, not a lot, but a good amount about the pandemic. And whenever I tweet about India, just the torrent of anger and hatred that comes at me. And the standard stuff of you're not a real Indian, and if you really cared about India, you would live here. And I mean, my goodness, like, we shouldn't have to prove that we care about India or love India. And you should judge me by what I'm saying, not where I have lived or what my last name is. But in this anger and that disseminates in social media is a huge problem. It really, the sources of misinformation and the way that we're using it. So I don't have any very good solutions. What I do think is important is that people engage more and that voices of reason engage more. Because if you have only people who are angry, only people who are partisan, only people who are political engaging in that, then it makes it very, very hard to have a national sentiment of what needs to be done and how we move forward. And I worry about our ability to have common discourse. And this is where we need social scientists. This is where we need people who have expertise far beyond mine to help us think about how do we do this. One of the things I have tried to do, at least in the United States, but I've tried to do this a bit in India too, is to try to speak to information ecosystems, or I say newspapers, television, that cuts across political lines, or at least is in different camps. Because it's very important that public health experts be seen not as pro-Biden or pro-Trump or pro-Modi or anti-Modi. That's not the point. The point is a public health crisis. Whether you voted for Modi or you didn't, the virus doesn't care, and the public health response has to not care too.
Three more large questions, but I'll state them concisely. What does evidence suggest on the vulnerability of children in the subsequent waves? And there's another
question. What does the evidence suggest on what? I didn't catch that.
On the vulnerability of children.
Oh, a vulnerability of children.
And there's another question on why does there need to be so many waves? And there's another question that asks you to elaborate what you mean by social cohesion.
Three very good questions. So let's talk about children and vulnerability. The good news has been that in general, and you'll see me hesitating here, but I will make my statement and then I will explain it. Children have tended to do well in this pandemic. The infections have not tended to cause severe illness and death. That, to me, one of the saving graces. My goodness, imagine if kids were the most vulnerable or something. This would have been horrible. So that has been a good, one of the small pieces of good news in what is otherwise a terrible pandemic. That said, kids do get infected, of course. And what we have been seeing with some of the new variants, including the Delta variant, the double mutant and other, is that kids potentially get quite sick. Now, again, thankfully, deaths and severe illness in children remains very low, but I would say that they remain vulnerable for the next wave. And the best way to protect children, beyond the standard public health measures of people wearing masks, et cetera, is to get adults vaccinated. What we saw in Israel, what we saw in the UK, what we saw in the US, is every time adults got vaccinated, infection numbers in kids fell. You may say, well, how could that be? Well, children get the infection from somewhere. And the more people around them who are vaccinated, the more it protects the children. So essentially, until we can vaccinate kids, which is still some ways away in many places, the best way to protect kids is to vaccinate adults. Let's talk about why there has to be so many waves. There doesn't. You could have one wave and end the whole pandemic. It would be a massive wave. You would have to get 80% of the country infected. If you do the math, that would be millions and millions of deaths, but you could get it all done in one time. We don't actually want that. So what happens in country after country is number of infections start rising. Almost every country reacts too slowly. Some countries have always reacted very quickly. But my critique of India reacted too slowly in February, March, April, it's not India alone. Other countries have done the same thing. Until the infection numbers get very bad, then there's a strong public health response, lockdowns, et cetera. Infection numbers come down. And then everybody relaxes, says, oh yeah, wave is over. And then people start going back their business, and then another infection start rising again. The infections are going to rise as long as people act in ways that lead to it. So the virus is not causing the waves. We are causing the waves by the way we are behaving, right? So we could just let the virus run and let everybody get infected. But I will promise you it will cause so many millions of deaths and will be so devastating that we don't want to do that. What we want to do is, as we come down from the wave, is we want to keep enough public health measures in place that we don't get a big wave. Maybe we get a little bump and then we control it. And we want to do little bumps along the way until we can get everybody vaccinated. That should be what we should be going for. But that requires sustained public health effort. I believe until the pandemic is over, no large gatherings. And that means, right, no weddings and all these things that are so important. Very, very hard, but we probably have to wait another year and a half. If we don't, we're going to see these large outbreaks. So large gatherings, mask wearing, no large gatherings, mask wearing, more testing. If we can keep that going as we come down from the wave, we can sustain that. We can prevent a third wave. What was the third question? Social cohesion.
Yes.
You know, social, I mean, you are this, there are a lot of social scientists on this Zoom call who are much better prepared to talk about social cohesion than I am. I will say my very simple understanding of social cohesion is it's about norms, it's about values that we share, it's about identity, it's about what draws us towards collective action. Why do people feel, a certain sense of desire to act in a way that's not just about personal interest, but also about collective interest? And how widespread is that? And how strong is that? Is how I have tended to think about social cohesion. In countries with strong social cohesion, you tend to get broad action, deep action, everybody acting in a certain way because maybe the government or maybe religious leaders say so. In countries with weaker social cohesion, you tend to have a lot more fraying, tend to have a lot more disagreement and fighting. And I don't mean just good-hearted, normal disagreement that is important, but people refusing to do things that are going to be important for public health, people trying to undermine public health. Those are the things you see in places with weaker social cohesion. But again, there's a lot more expertise on social cohesion on this call than I have.
Thank you. 3 more questions. If new mutants emerge, can the current vaccines work? And if the pandemic lasts for longer than we think, what might be the consequences for the poor? There's another question on what explains the appeal of conspiracy theories regarding the pharma industry and the IFIs that unites the far left, the far right, the animal rights groups, etc. And there's a third question on, will models of city planning change from now on?
Wow, a lot of very, very good questions. And remind me of the first question again, Chandan.
The first one is about if new mutants emerge.
Mutants and vaccines and the poor. Yes. Boy, some very, very good questions, and I'm going to forget them as I answer, but maybe you'll remind me. So let's start with the vaccines. So far, I have to say that I have another place where I have been surprised is how good these vaccines are. The vaccines have been really quite remarkable in holding up against the variants, against the mutants. Not perfectly. You do see some breakthrough infections. But mostly vaccines, fully vaccinated people, and we all hear stories, somebody was fully vaccinated, still got sick. They happen. They're very rare, right? The vaccines are not 100%, but they're very, very good. And I am hopeful that they will continue to be very good against future mutants. But hope is not a strategy. And so the best way to prevent more mutants from challenging our vaccines is to prevent large outbreaks. Large outbreaks fuel more mutants because large outbreaks give the virus more opportunities to create mutations. So if we want to prevent, testing of whether our vaccines will work against future variants, let's not have a lot of future variants. Let's keep the infection numbers down. But I am hopeful that they will hold up. One of the things we have learned in this pandemic, and this may be no surprise to anyone on this call, is while the pandemic is horrible for everybody, it has absolutely disproportionately affected the poor. When you go into lockdowns, for instance, day laborers, people who subsist on the margins of society, for them, it's been awful. The estimates of the numbers of people, the crores of people who have been thrown into poverty, all this economic development, a decade, 2 decades of economic development, have been largely undone in this pandemic. Now, it won't be undone forever. We can recover a lot of it. But we have to have some very aggressive pro-poor policies to both help them get through the pandemic, but then help them get back out of the poverty that the pandemic has created. It's a huge challenge. All right, give me the other questions because I'm already forgetting them. I should have written them down.
The other question is the enormous popularity or appeal of conspiracy theories.
Oh, conspiracy theories, yeah. And especially against the pharma industry.
Yes.
Yeah. So look, in a crisis, if there is an information vacuum, if there is lack of high quality information, somebody will step in and fill that vacuum with misinformation. Conspiracy theories, rumors, these kinds of things always come up in a crisis. But how widespread they are, how much people believe them, is driven by how good a job public health officials, political leaders are able to do in filling in good information. If you have lots of very good information, it's harder for conspiracy theories to take hold. Not that they won't, they still will, but it won't be as widespread. So any place you see a lot of that stuff happening, it's usually because there wasn't good information to counter it. And the best way to counter it is good information and trusted voices. The pharma industry, anytime you find yourself implicating an entire people, the pharma industry, if you understand them, they're a bunch of companies trying to make profits, but they're made up of people. They're not evil people. They're not like sinister people. Some of them behave badly, and then we find it. But this idea that an industry could create a conspiracy, there are millions of people. It's hard. If you've ever tried to hold a secret with like 4 friends, one of them will tell somebody. The idea that you could create a conspiracy that millions of people are hiding and it hasn't come out doesn't work that way. So, and part of the problem is that we have all this rhetoric in regular times about very anti-pharma. I look at pharma like look at any other industry, the car industry. What are they trying to do? They're trying to sell me cars so they can make a profit. That's what the car industry does. That's what the pharma industry is. They're trying to sell me drugs. And it is up to me and my doctor to try to figure out, is this a drug that's good for me? And should I pay for it? And should I take it? And so it's very tempting to fall into this, but we all must show the discipline of not doing that kind of stuff. And this happens on the left and right. The left tends to hate big corporations. The right tends to hate big government. And so on the right, the conspiracy theories are all government has created this to subjugate people. And on the left, it's all, that governments, that the pharma has created this to do this. I think we all must fight the temptation to fall into this. And I know there was one more question, Chandan, maybe we'll finish with that, but please go ahead.
The question was on models of city planning post-pandemic.
Yeah, this is a very good question. I don't know I have much insights onto this. I will say that cities, first of all, I think cities have become more and more important for public health. they're really fundamental in some ways. For the first time in human history, in 2015, I think was the year, no one knows for sure, more of humanity lived in cities than outside of cities. Humans have always been a rural species. And cities are a new phenomenon in the history of humanity. And in 2015, 14, 15, somewhere around then, for the first time, human species became an urban species with more people in cities than outside. I think this pandemic has shown us, and there will be future pandemics, there's climate change, there's a set of challenges. It has shown us that we really need to think about how cities should be planned, how they should be planned in the context of large disease outbreaks. And that's everything from how to think about where people live, the ventilation of indoor spaces, how you think about outdoor spaces. There's just a lot of work that needs to be done in this. And I'm hopeful that city planners will start realizing that they have a very large role to play in public health going forward in this century.
Thank you very much. We have reached the end of the 1 hour session, and I suppose we need to let you go. And I don't see the chair here. Has he made it? Professor Pramod Kumar, is he here?
Is there? No, Professor Abhijit. He came in between, but
yes,
then
I saw. Yes. Okay, so I'll presume he's not here. But thank you very much. I see him entering the admit room. Let's just give him a minute. Professor Sen, are you here? He's still connecting, I suppose. He's here. Professor Sen, I know you joined us late. Is there something you would like to say? We have concluded the Q&A actually, but we'll have a minute for you.
He's muted. Okay.
Okay. Okay, I'm glad you could join us at the very end, at least. So yes, thank you, Professor Jha, for that scintillating talk and engaging the question and answers session so beautifully. There were a few more questions, and apologies to those whose questions I couldn't raise and share with Professor Jha. Hope there'll be another occasion to interact with you. A huge thanks again to you, Professor Jha, and to all of you in the audience, and to my colleagues in ISAC and the tech team that's working behind the scenes to make sure things happen without a hitch. Thank you all again.
And I just want to very quickly say thank you for having me. Thank you for the questions. I'm sorry I could not get to more, but what I look forward to is the opportunity to come visit in person and be able to gather together in person and have a discussion about how we finally did get beyond this pandemic and how to create a new health system, public health system for India that will become not just world-class, but also one that can manage future pandemics. That's a discussion I would love to have, and I look forward to the day when that is possible. So I hope that next time I'm able to visit India when it's safe, that I may be able to come and visit with all of you in person.
That would be great. And I forgot to thank Professor Ashutosh Varshne, who was key in getting this talk to happen. You know, he told me that Professor Jha has 600 invitations, but I'll try nevertheless. And I'm glad you could make time to be with us this evening. Thank you, Ashu. I see him here, but I'm not sure if he's behind the screen. Thank you all again.
All right. Bye-bye, everybody.
Bye.
Thank you, Chandan, for carrying it perfectly 1 hour. Thanks to our distinguished guests. Thanks to Professor Ashish delivering the lecture, and thanks to Ashutosh Varshne for facilitating it for us. Thank you, one and all. It was a really motivating lecture today, and we hope we'll come up with another lecture sometime soon. Thank you. Thank you, everyone.
Thank you. Thank you all.